Hey guys, so this is a video about right after you get your palate expander, what the instructions really are to use it properly and to take care of your teeth during your treatment with the expander. So the first thing I want to show you a little bit is most of our expanders these days are like this as opposed to what we were doing a year or two ago like this. And here's the difference, is that you would notice that when we place your expander, your child's expander in, that there really was no discomfort on putting it in. Now, this is the traditional style that we stopped using, and you can see on this model is, there's the rings actually go around the teeth, which means they have to wedge in between the teeth when you place it and when we fit it, which is not terrible, but it can be a little uncomfortable. The style we use now is more of a custom-made style, and these metal bands are no longer stock bands, so there's a good chance that your child has one of these that we've placed in. All right, where these are custom made. These are metal printed, so 3D printed in metal to fit exactly your child's tooth. And the nice thing is they don't actually get wedged between the teeth. They fit exactly the shape of your tooth. So it was really just cemented and snaps right into place without any discomfort between the teeth. So let's talk about the right way to activate this. So to activate an expander, we have a key. All right, and we would have shown you this during your first appointment, but the key really just, all it is a little, this is a big handle, and this is the action part right here. And you can see there's a little bend on the end of that key there. That's so when you put it in the hole, it can't go in too far and you can't poke your child, all right? So this is the front of the mouth, this is the back of the mouth. Obviously the throat is back here. If you look closely at the expander, you see little arrows on there, okay? So this is telling us where the hole is gonna go, the key is gonna go in the hole. So the key goes in from the front, okay, we're gonna get it back to the starting spot. So this is the starting position right here. Okay, so the key goes in, and then what you're gonna do is you're just gonna push towards the back of your child's throat, towards the back of the mouth, and that's a turn. So if you look closely, we started here, okay, and we just push towards the back, okay. There's two holes, and you see the new hole is there for the next day. So all these holes do is trade place, so they rotate. So you start from here, you push back there, you're going to remove the key. We gave you some tips on how to take it out, okay, when you were here with us. But that's one turn. That turn will expand the mouth, expand the palate about 1/4 millimeter. And you think about how small it is, that's why it's not really going to be uncomfortable. It's typical to feel some tightness for a few minutes, which tends to dissipate. Now, every day you turn this. Now, your instructions are going to be to turn this once a day, usually every night. Before bedtime is a good time to do it. Once a day for 3 weeks initially. So you first get your expander. You're going to do this, what we just did, this process, one turn for 3 weeks. All right, and then we're going to check the progress. Whether we check it in person, if we have an arrangement where you're going to send us some photographs online, either way, we have to check the progress at 3 weeks. What you will notice over those 3 weeks, and this model is showing a space between the teeth. If you don't have a space, you're going to get one. It's going to be temporary. If you have a space, it's going to get bigger. Again, temporarily. That's a sign that it's working properly. Okay, so once a day, you're going to turn the key. It's really more of a push than a turn. All right, you see where the two holes are there. Now, if you don't finish pushing that key back, okay, or if you unwind the key when you're taking it out. So if we put it in and you push and you don't finish the turn, or when you take it out, you kind of undo the turn a little bit, you'll look the next day from here, and you would look in the mouth this angle here, and you wouldn't see a hole. All right, the hole is usually right in the front area right there, okay? So that's when we'll get calls from parents saying, hey, we lost the hole. We'll get you back in. We'll find the hole that you can't see all the way in the back, because again, this is the back side of the mouth, and we'll finish that turn for you, okay? But it's important to finish the turn, okay? And don't unwind the turn when you take it out, okay? Now, as far as caring for this, all right, so we would have given your child instructions on how to brush properly, which is a 2-minute process, top and bottom teeth. But also we're going to add in here is that you have to make sure you're brushing on the expander itself. Food obviously will get caught in this area here. Okay, so we got to make sure you're brushing this whole screw area, this whole palate expander across the middle of your mouth really well, twice a day every time you brush teeth. 3 times is better, but minimum twice a day, morning and at night. If by chance some food gets stuck up here and you cannot get it out, this is why in your kit we give you a Proxy Brush. Okay, a Proxy Brush is really just looks like a little pipe cleaner. Okay, you can get these in bulk at the drugstore or Costco or BJ's, but they're reusable, just like a toothbrush. You can rinse it off, use it again. All right, But really what you can do is you can bend it, and I like parents to help with this sometimes. If there's something stuck under here, you can kind of get it out, okay? You can get underneath the wires anywhere you need to and really get anything out that gets stuck, all right? So this is a nice tool to keep in your bathroom. If you're going away, bring it with you. It's a good way to kind of get little pieces out, okay? So that's the Proxy Brush. We're also gonna recommend that you use an over-the-counter fluoride rinse. It can be Act like this. It can be Listerine Kids fluoride. The important thing is that it's a fluoride rinse. All right, the fluoride is meant to strengthen the enamel of your teeth to make you more resistant to decay. All right, this is different than taking vitamins with fluoride in it, because this is topical. This is only going on the outside surface of the teeth. You want to rinse for 30 seconds. Actually, I'm sorry, 60 seconds. You're gonna spit out. After you spit out, you're not gonna rinse with any water for at least a half an hour. Okay, so the best thing is right before bed, after you brush, you rinse with your fluoride rinse, you spit out, and you're done. Okay. We do include in your kit some wax. All right, so not that often do you need it for an expander, more often with braces, but the wax, you just take a little piece, okay? It's soft, you kind of roll it into a ball, okay? And you would stick it wherever was bothering you. There are these little pieces over here that we use to kind of place it and take the expander out. It's possible that can irritate your cheek in the beginning. Before you get used to it, you can just stick some wax on it, okay? It'll stay on usually for a while. If it falls off and you swallow it, it's okay. It's just wax, it's not gonna hurt you. But usually you wanna take it out before you eat, just so you're not chewing on it. But again, it's safe, it doesn't matter, it's just wax, okay? So just to kind of review here, the expander went in. All right, we gave you instructions to turn it once a day for 3 weeks, and then we check the progress. We will let you know to turn more or to stop, okay? Once we're done turning, at your following visit, we will place a material in this screw mechanism to kind of lock it in place, and less food will get trapped in there as well, okay? So 3 weeks, you have a check with us, we'll tell you to do more or to stop, okay? Once we're done turning, the expander will stay in for 6 months. All right, that's the time that the palate is now, I wouldn't say healing because we didn't break anything, but it's stabilizing. That palate has been stretched apart, and now it takes time for the bone to kind of reform and reharden in that midline so everything kind of settles in. Most of the time you will get a few braces on your front teeth here during the 6-month process of stabilization, just to get rid of that space so we don't leave you looking like SpongeBob, okay? So we always want to make sure the front teeth are kind of brought back together if they didn't have a space in the beginning. All right. Any questions, you can always call or email us. Hopefully that answers your question with the expander, gave you a little walkthrough. There is another video on our YouTube site with showing inside an actual patient's mouth, me talking you through the process, because it is a little different looking at a model of teeth versus looking inside your child's mouth. So that video is helpful too if you need to teach someone else at home. This is simply the instructions that we tend to give you at the end of the appointment. So this is just, here's a reference for you guys to review. Hope that helps. Good luck with your palate expanders.